Well, turning now to Justin Bieber, who says he's dealing with a medical issue that will force him to postpone several concerts.
The pop star says it's caused his face to be partially paralyzed.
As you can see, this eye is not blinking. I can't smile on this side of my face. This nostril will not move. So there's full paralysis in this side of my face.
Wow, well, Bieber posting this video to Twitter saying he's been diagnosed with Ramsay Hunt Syndrome. He says it's affecting a nerve in his ear, which has, as he just described, paralyzed part of his face. He says he's doing exercises right now and hopes everything gets back to normal. But he apologized to his fans for postponing his shows and says the issue is pretty serious and needs to have him take time off just to get healthy. It's unclear how long that's going to take.
So joining us now to talk more about this medical condition is Dr. Adeel Popalzai from Pomona Valley Hospital Medical Center. Thanks so much, doctor, for joining us.
My pleasure. Thanks for having me.
First and foremost, we all watched that video and have, I'm sure, many questions. So we want to know, what is Ramsay Hunt Syndrome?
Right. So Ramsay Hunt Syndrome is actually a pretty rare neurological disorder. It affects somewhere between 5 and 100,000 patients per year. It can happen to both children and adults. But typically the symptoms are just like you saw in that video that you just showed, that it can cause facial paralysis, and it can also be accompanied by a rash that usually develops around the ear or in or out of the ear.
And Adeel, how is it that you get it? Is this something genetic? Is it something that can strike anyone, or do we even know how you get it?
That's a great question. Yeah, technically it could happen to anyone. Like I said, children and adults can get this. It's caused by a very common virus, even though it's not a very common condition. So typically, for those of us who have had chickenpox, it's the same virus that causes chickenpox. Another, it's called the varicella zoster virus, and can also affect adults who develop shingles. So this is the virus that typically causes it, and it then causes inflammation of the facial nerve, which causes then the facial droop, which is what you saw in the video.
Wow.
Yeah, and you know, we're talking about Justin Bieber needing to cancel some of his shows to get healthy. How does it affect your vocal cords?
So it doesn't specifically affect your vocal cords, but because of the facial droop, it can cause you to have actually slurred speech. And so for someone who performs and sings regularly or performs at concerts, it can really affect the way you perform and sing. So it doesn't affect specifically the vocal cords, but it can definitely, because of the droop that it causes, cause slurred speech. So it could definitely affect him.
And I think Justin Bieber had, said he's doing some exercises to try to get better. Is there a cure? Is the only thing to do try to do some exercises to get that side of your face moving again, or what is really the prognosis of that?
So the prognosis could be actually pretty good. Yeah, exercises do help, but typically there's actually medications that we can give, and there's a combination of medications we give for this condition. So the first one is an antiviral medication, typically called acyclovir. And the second medication is an anti-inflammatory steroids, as we all know, high-dose steroids. So combination of those two can actually help really reduce the impact of the inflammation on the facial nerve and really help improve symptoms. But we really want to catch patients early on in the course. Typically, we want to give treatment within 3 days for a better outcome. So yeah, he can improve and recover from this, but only time will tell.
Yeah, I guess my question was, are there any lasting effects after this?
Right, that's a good question too. So it can linger a bit. So typically, it can improve drastically with the medications, and you can improve back to normal. But there could be some lingering effects. There could be still some subtle facial droop, some hearing changes that can last. But again, if you catch it early on and treat it appropriately, then patients can get better.
All right, well, that's the best news of all. Thank you, Dr. Adeel Popalzai, for joining us and helping us learn more about this issue. Thanks for your time.
Thank you.